Hello, my name is Annalie Martin, and today I will be going over the different patient positions. So first we have semi-Fowlers, that is 30 to 45 degrees, and that does promote lung expansion, and it is sometimes used for feeding depending on the patient's condition. We also have high Fowlers, that is 90 degrees. That is if a patient is conscious, you would usually use that for oral care. And that is going to be the preferred way of feeding for a patient. And that's also just a great way for patient comfort if they're in the hospital and they're watching TV. Just that could be a good position for that. We also have left side lying. That is usually, that would just be where the patient is laying on their side. That would be a good temperature. That would be a good thing, I think I already said, for rectal temperature, rectal examination, and that would be good for the unconscious patient that needs oral hygiene. That may also be a good sleeping position. We also have the orthopneic, which in that position the patient is usually laying in the bed, and then a lot of the time they'll have like some form of support in front of them where they're laying over like that. That is good for patients with COPD or any type of condition that affects the breathing or the lungs, and that will help the patient to get better lung expansion in that way. We also do have supine position. That would be vital signs if they're having cardiac and abdominal surgery, and it's also a good way to assess their head and their neck, and also if you did like a breast examination, the supine position would be good for that. That is also a good rest position, and that is where their head and their spine is aligned and their arms are at their side. So we also do have the prone position. This will reduce strain on the lungs and some back injury types of wounds. If you need to care for any wounds on their back, then the prone position would be a good position for that. Now that is good for acute respiratory distress, and also that is a good position for that has become very common for COVID. You do see that being used a lot more. To position a patient in the prone position, you will need like a lift sheet, and you will want to slide the patient to the edge of the bed, and you will definitely want at least, a lot of my research says about 6 people. So you're going to want a lot of people to help move, because it can be difficult to turn that patient. You will want to be able to use the sheet and the sliding the sheet that helps slide the patient to make sure that you have enough help and control so that everyone is safe, and make sure to use those body mechanics. So with the lithotomy position, that is something that is very common at the gynecologist. Usually your feet are supported by stirrups. It also can be used for childbirth, gynecology exams, surgery, and also surgery of the pelvic area. So usually your legs are flexed 90 degrees at your hips, and the knees are bent, and your legs are usually up on those foot stirrups. Or some type of padded footrest. Now the knee to chest, that would be where you're laying down with your knees up to your chest on the bed. And that is also used in childbirth, gynecology exams, sometimes with rectal exams they choose that position, and also lumbar spine surgery. That is my explanation of all of the positions. Thank you very much.